In this episode of the ASC Podcast with John Goehle, we cover the latest updates from the ASC industry, discuss possible supply chain issues in the new year, review the stalled Corporate Transparency Act and how it would affect ASCs, and in our focus segment, we provide tips for preparing for a possible survey in 2025. Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We'd like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, RFX Solution, your all-in-one healthcare regulatory compliance software, Trivalence, offering a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. MedServ, which is the only digital narcotics cabinet specifically designed and priced for surgery centers, helping to standardize processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. Welcome to episode 237 of the ASC Podcast with John Goehle, recorded on December 31st, 2024, from our studios in Spencerport, New York. I'm Sue Cronkite, your co-host and operations manager at Ambulatory Healthcare Strategies. As a reminder, the regulatory landscape for ASCs is constantly changing. The content in this episode reflects the most current information available at the time of recording. We encourage all ASCs to remain vigilant and keep up with any updates or new guidelines released by relevant regulatory authorities. Joining me today is John Goehle, the owner of Ambulatory Healthcare Strategies and one of the leading experts in the ambulatory surgery field. With over 3 decades of experience, John has authored more than 10 books on the ASC industry, and he is a highly regarded speaker on topics related to regulation, accreditation, and finance management.
Well, Happy New Year, everyone. I hope everybody's had a great holiday season. We certainly did. We have a lot of grandchildren, don't we, that have kept us very busy during this time frame. And I think we noted this the last time, but we think that Rosie might be due to have a litter of puppies sometime in February. So we're very excited about that. Sue, as you were doing the lead in there, talking about how you need to be vigilant about any changes in regulations, I was thinking about the whole issue of the CTA, the Corporate Transparency Act.
Yeah, back and forth.
Which we have been following very closely here. We actually almost did it like an emergency podcast when the rule had changed. We'll talk about it in a few minutes, but it's something to keep an eye on. And so definitely. When this episode drops, you might want to double check to make sure our conclusion is still the same, but it definitely is something to keep a close eye on. We do have an upcoming administrators boot camp at the end of the month of January. So for more information, follow the show notes. There'll be a link in the show notes if you're interested. And to remember to be prepared for the new year. Don't forget about the annual meetings. We talked about that in our last episode. Episode 236 gave you some guidance as to the types of things you need to discuss during those meetings. And also, this is a good time to think again about education, both for your staff, making sure you're prepared for, all the annual training that has to be done, and for yourself. I know, Sue, you've been very busy planning out our year with our various conferences and making sure that we're a member of the appropriate associations that we work with here. But that has made us think about our budget for the next year and how we're going to spend it on that education. So make sure you sign up for those things pretty quickly. I think it's too late to get the discount for ASCA, right? Or I think you signed our staff up for the discount. There might be some other.
I think there are different levels.
Tiers.
So,
yeah.
And it's worth going at, and it's going to be beautiful. It's going to be in Denver.
Yeah.
And it's going to be gorgeous.
We're looking forward to it. Unfortunately, Sue, I think you're going to be staying home if Rosie indeed does have puppies, because we'll have puppies that we have to deal with here. Let's talk a little bit about some news.
So I just wanted to update you on something that we've talked about before. The temporary contract between the U.S. Maritime Alliances and the port workers expires on January 15th. As a reminder, the dock workers had been asking for a 77% pay raise over the next 6 years, and they wanted a total ban on automation. They were offered a 62% raise and a promise to limit automation. So the union broke off negotiations in November, saying the ocean carriers and terminal operators were trying to eliminate jobs by pushing that automated container handling. Some shipping companies are planning to implement surcharges on containers being delivered to the strike areas to cover for any of those delays and disruptions. Depending on the size and the destination of the cargo, these charges can run from $800 to $3,000 per container. And since they did not reach a final agreement, it's expected that the strike may resume in January. And both sides released statements last week. So the U.S. Maritime Alliance released this statement. Modern technology has proven to drastically increase the amount of cargo that can be moved through a port annually. We have been clear that this can and will be done in a way that not only protects jobs, but adds new jobs as our operations expand. And the International Longshoremen's Association countered that automation of our nation's ports should be a concern for everyone. The truth is, robots do not pay taxes, and they do not spend money in their communities.
So again, this could have a huge impact on our the prices for supplies and the availability of supplies. And it's not like we don't already have a problem. I mean, definitely things are tight in some areas. So definitely keep an eye on this. What I would recommend is that you communicate with your distributors and any manufacturer's reps that provide you supplies. Hopefully they'll be up to date on those things that might be at risk of not being deliverable. Yeah. But definitely you need to be very proactive here. Otherwise you could find yourself in a situation where you're not going to be able to do surgery.
Yeah, and as they said, the dock workers wanted 77% pay raise. They got 62%. So that's something. The real sticking point is going to be that automation. Because I don't think that I don't think it's ever going to be a permanent promise that they'll never automate anything. And actually, with the changing administration, Trump has really supported no automation. So I don't know if that will help or hurt or what as we move into that.
I don't think it's reasonable either. You know, I think in order for the East Coast ports to be able to maintain operations and be able to handle the amount of cargo that is incoming, they're going to have to automate. And we know that the West Coast, as I understand it, the West Coast ports are, much more automated than the East Coast ones are, which would mean that, the East Coast ports might not be as competitive in the future if they don't start doing some type of automation. So this is going to be very interesting to follow. And again, we're not taking sides here. We just hope that this will be resolved in an expeditious way. Yeah.
And there was an interesting article in ASC News by Shelby Grebin from November where they talked to Jeffrey Flynn, who is the president of the Gramercy Group and also now the New York State Association for Ambulatory Surgery Centers, about how the pandemic changed how ASCs are viewed and what their role may be in future emergencies. So we all remember that ASCs were not initially allowed to do procedures, and this led to increased rates of stage 4 colon and stage 4 breast cancers due to delayed screenings. As ASC leaders advocated for the importance of keeping ASCs open, they were allowed to do some elective procedures, which I would put that elective in quotes, as often they were necessary procedures or screenings, that would have left the patients with more complications and, really risked their health if they were postponing those. So some procedures began to shift to the ASCs. Patients always felt more comfortable going to an ASC than they were going into the hospital, especially during the pandemic. And Jeff noted that he's going to focus on bringing more advanced cardiac procedures to the outpatient settings.
And make sure that we don't run into the same scenario that we did the last time where what we really realized was essential services are not being curtailed for extended periods of time.
So Woodrow Moore, the founder of the Texas ASC Society, stressed the need to have a national disaster preparedness strategy that also includes ASCs. We also remember ASCs were allowed to become temporary hospitals during the pandemic, But that was a pretty complicated process that not many did.
And it was also complicated to unwind after they had become a hospital. We talked a little bit about it in several of the episodes, but it was difficult to become and then to unwind from becoming one. And I don't think many surgery centers actually went through that very complicated process.
I don't think many did. And so, the hope is as we bring more procedures in and the regulatory and political leaders understand more about what we do and how we can be helpful, they're going to allow us to continue operating as much as possible in any future pandemics. And not just that, but, hurricanes, fires, any damage to a hospital where they can really call on the ASCs to pick up the slack. And I saw an article in The Hill about a new report from CDC about vaccination rates. And this was a couple of weeks ago, so, the numbers may have changed. But the CDC reported that only 17.9% of adults in the U.S. had received the COVID vaccine and 34.7% had received the flu vaccine for this respiratory disease season so far. Puerto Rico had the lowest percents of these vaccinations, with 5.2 for COVID and 17 for flu. The rates were highest for flu vaccines in Maryland at 50% and in Vermont for COVID at almost 34%. They noted that overall 30 to 40% of adults were open to getting the vaccines. They maybe just hadn't gotten around to doing it yet. Not surprisingly, the vaccination coverage in general increased with age because we all just worry a bit more about, the damage to our health. And it was lowest in those who are uninsured. And the CDC estimates that the flu results in between 100,000 to 710,000 hospitalizations and between 49,000 to 51,000 deaths a year. So, we're leaning a little bit more away from worrying as much about COVID and remembering that the flu can be very dangerous too.
Yeah, I think those statistics were surprising to me, especially the COVID statistics, though I believe you're talking about COVID boosters, right? Not initial COVID vaccines.
I believe, but I think as every year goes, at this point now, it's not so much I guess it kind of is just like the flu. You get a new flu vaccine every year and the COVID vaccine. So it would be kind of the yearly. So
Right. Well, again, I think we need to remember and also follow your state requirements with regard to vaccination for flu. Some states do require it to be done, or at least reporting to be done. So there is no national requirement through the CDC anymore for the flu vaccine reporting. There is still a requirement from the CDC for the COVID vaccine. So I think we've talked about it in the previous episodes, and that's all part of the Medicare quality reporting requirements. Yeah. But you do need to make sure that you're up to date with regard to any of the requirements that you might have in your state. But again, those statistics are pretty scary. And Sue, I thought that range between 100,000 and 710,000 hospitalizations was a very wide margin there. So I assume that's because they can't always classify the reason that somebody has been hospitalized.
Yeah.
And then finally, let's talk about the Corporate Transparency Act, or the CTA. Those that have been following the news recently, especially the business news, know that the CTA is a act that was implemented in 2021 but was put on hold through court order. And then in mid-December, the court allowed the act to be implemented. And then very shortly after, I think within a couple days, another court stopped it. So let's talk a little bit about what the CTA is and how it would impact you. So the CTA, or the Corporate Transparency Act, would require eligible small businesses to report the following: the full name of their company, the company's business address, the taxpayer ID number, and identity documentation for owners of over 25% of the organization. So this would impact quite a number of ambulatory surgery centers. And you would go to a website where you'd be able to report it online. There are also companies out there that would, for a charge or for a fee, sign you up, but that's really not necessary given that the website is readily available to everybody. We're keeping a very close eye on this. We'll provide a link to the website where you would sign up. I would not encourage you to do that at this time because you probably are going to find it a little bit cumbersome with regard to gathering the information on the owners of your organization. So,
and I think, though, making sure that you are able to get that information if it does get kicked back in and you've got maybe a month or 2 weeks to do it, just make sure that, if you've got somebody going out of the country for little while or something that you've got that information.
Correct. Under this act, the businesses that fall under the definition of a reporting company, which would include most ambulatory surgery centers, must file a beneficial ownership information report, or a BOIR, with the Federal Crimes Enforcement Network, better known as FinCEN or FINCEN. Anyone who willfully violates that requirement would have been subject to civil penalties of up to $591 per day. And they may also face criminal penalties for up to 2 years imprisonment and a fine of up to $10,000. So needless to say, those are pretty significant fines that you would have, which is one of the reasons that we considered doing an emergency podcast on it. And just as we were about to do that, that's when the court put it on hold again. I do believe with the incoming administration that it is not likely the incoming administration will allow this act to continue. But then again, you never know. And again, it's something we have to keep an eye on. So the timing, as long as it's on hold, we don't have to act. And I think we have until January 20th when the new administration comes in, hopefully. I believe this is a pretty cumbersome requirement that I think is probably unnecessary, but that's a personal opinion there. But definitely we have to keep an eye on it for any small businesses, by the way, not just ambulatory surgery centers. So as we get ready for the challenges of the new year, I thought it might be useful to talk a little bit about how we prepare for a survey again. We've, a lot of our podcasts discuss various aspects of surveys, but let's just put it in perspective. Let's talk about some very high-level things that you can do to prepare. Even if you just had a survey or don't have a planned survey in 2025, remember that a surveyor can show up at any time. So let's take a short break, and when we come back, we will talk about getting or staying prepared for a survey. It's been a long day, and the surveyors just left, and you are exhausted. And looking at the list of items that you have to address, you wonder, how can I deal with this and still take care of my patients? More importantly, you wonder, how can I ever keep up with all of the regulations, standards, and accreditation requirements? How can I always be prepared for a survey and reduce my stress levels? Well, that's what Ambulatory Healthcare Strategies does, day in, day out. We become your outsourced regulatory and accreditation resource. We can maintain your policy manual, develop your education programs, help out with fire and disaster drills, do your risk assessments, oversee your quality improvement activities, help run your quality improvement meetings and governing body meetings, and we can even prepare your monthly or quarterly financial statements and help you figure out where you are financially. We are a retainer-based service. We don't take ownership. We don't charge based on your revenue. We have one fixed monthly fee, and we can tailor your services to your exact needs. So whether you're looking for help getting over a survey, preparing for a survey, or looking for a long-term relationship to assist you with your ongoing regulatory and/or financial needs, please give us a call at 585-594-1167 or email us at info@ahstrategies.com. That is info@ah-strategies.com, or visit our website at ah-strategies.com. So one thing that we know is that a survey can occur at any time in an ambulatory surgery center. Even if you just had a survey, you might find a state surveyor coming out or CMS coming out, or there could even be an accreditation surveyor coming out in between that triennial survey cycle that you go through. So first of all, you need to always be prepared for a survey. Make sure that your employees are always aware that a survey can occur at any time. Make sure that your owners and the providers are aware that a survey can occur at any time. And one thing that I always recommend doing is to develop what I call a survey protocol, which provides staff, and especially your front desk staff, information as to how to respond to a surveyor showing up at your front desk. And a survey protocol is just a simple document that outlines the steps to follow, who to call, including the telephone numbers or text numbers of the individuals that have to be notified when a surveyor shows up, what to do if the receptionist is not able to contact somebody from administration. That's happened to me, Sue, as a surveyor, where, I show up and the receptionist is kind of very...
Probably a little panicked.
Yeah, exactly. A little panicked and can't get a hold of their bosses because, sometimes they show up a little bit later. And then also discusses things like where do you put the surveyors, what information you get to them right away, and what you do in order to assure that your operations continue. It can be very difficult if you're already short-staffed to deal with surveyors at the same time that you're trying to maintain operations.
And you don't just want to put them in a room with nothing to do and to sit there and get impatient, because that just starts the whole day off bad. So
that's right.
That's why, like you said, having a list of some things that you can get them started with is helpful.
What's great about doing a survey protocol, and again, there's no particular format for this, just usually a single sheet of paper that you provide to your receptionists that provide them information as to what to do when surveyors show up. But it removes uncertainty. And the nice thing about it is it really demonstrates organization to surveyors. I really enjoy it when I walk into a center and I'm greeted warmly, by people. Yeah, I mean, I know they're somewhat fake enthusiasm for my appearance, but it is nice to know that people are prepared for us. So let's talk about some things to remember. Remember, a survey is not just about the paperwork, but the paperwork is important. So probably half of the survey is going to be the surveyors looking at paperwork, and the other half walking around, observing procedures, talking to employees, et cetera. So it's not just about paperwork, which many of the owners and providers think is a focal point of a survey. And one thing that I really try to remind all of our centers is that you want to avoid that I will do it during the survey mentality. In other words, we hear providers often saying, well, I'm not going to do that all the time. It's stupid. I'm just going to do it when the surveyors show up. And what we know is they probably won't. They won't remember that that's something they need to do during a survey. And it's not the right thing to do, by the way.
Yeah.
It's not ethical. And it will look fake. Surveyors will see through it. We're pretty smart people. And if you're doing something that you haven't done on an ongoing basis, it's going to probably be pretty obvious to a surveyor. Another thing that I'm pretty passionate about, Sue, is reminding people that regulations are not just something that someone made up to annoy surgery centers. I know that sounds silly when I say it that way, but I've been accused of that by owners and by administrators and directors of nursing. Oh no, you're just making these things up. No, there's a reason those regulations are there. There's a reason those accreditation standards are there. They're there to protect the patient and the staff. And I get it. Some of these regulations are difficult to understand sometimes. Sometimes they conflict with other regulations, or it's not very clear as to what a surveyor is looking for. But those are all things that you need to resolve before you actually have a survey. And I think one of the best ways to prepare is make sure that you have a very strong education program. It's not just about your employees filling out that form on an annual basis that lists all the mandatory education. You want to make sure that people are always up to date with all of the latest regulations, all the latest requirements, that they're fully educated on what's going on in your center, and how you react to various scenarios that occur. And remember, it's not just the employees that have to have that annual education or that ongoing education or that orientation. Providers, including anesthesia providers, have to go through an educational program because they're going to have to know how to react during a fire, during an emergency, during a transfer, during a code blue.
Agency.
On agency nurses, right. So it's providers, agency staff, not just nurses, those, temporary employees, however you get them. Students have to go through the educational program. Vendors that are going to be in the room are going to have to at least have an overview of the policies that you're going to have. They need to know how to act in the event of an emergency. Usually that means just getting out of the way or perhaps leaving the surgery area, but that needs to really be well documented. If you have volunteers, we have a couple centers that have volunteers that work. They have to go through that same education program that the employees go through. And remember that the surveyors are most likely going to be asking your staff questions during a survey. So you want to make sure that they answer those questions appropriately, that they do understand what is required of them. I find that this is actually one of the ways that I often can find out if the education program really occurred. And I found that, a number of times as a surveyor that, the administrator and the director of nursing will be able to have the right answers. But when it comes down to the staff, they might not know those policies, might never have gone through that education program. We've seen scenarios where employees have just signed those documents, including the orientation program, without actually reading through the policy manual or without reading through it recently. So we talk about this during the boot camps, that every time I do that program on the conditions for coverage and the interpreted guidelines, I'm reminded of things
Yeah.
that I have forgotten over time. And I've been doing this for 30 years. I like to say that I know them like the back of my hand. But the reality is, as I'm even reading through them during an educational program, I'm sometimes surprised at some of the things that I find there. Yeah. So it is extremely important that you provide that education to your staff. But just as importantly, or perhaps more importantly, is that you need to make sure that you totally understand those regulations. You need to be up to date on it. You need to read through them on a regular basis. It's one of the challenges we've had with some of our new centers, for example, is that the administrators are so overwhelmed. The directors of nursing are so overwhelmed with starting up a new center, with all of the challenges that come with it, hiring staff, educating the staff, outfitting the place, that they forget that it's extremely important that they know what the surveyors are going to be looking for when they come out.
And the surveyor may even ask something as simple as, where is your policy manual?
Yeah.
Where do you find these answers? And believe it or not, a lot of times the staff doesn't know, or they don't have access to it, and then how are they may not have everything memorized. I mean, they should know the basics of what they're supposed to do every day, but some of the things they may need to look at, and that's okay as long as they can prove that they can find that information.
Right. And at the very least, know how to find an index of the policies, be able to refer back to the educational program if that's necessary. I also have mentioned this a number of times that you need to be very careful about those online programs where you log on to a website and you go through an online education program. They often, almost always, don't address all of the things that are related specifically to your center. For example, your emergency plan, your fire safety plan, your incident reporting program, your infection control program, your corporate compliance program, et cetera. All of those things are going to be very specific to your organization. And if you're signing up for one of these online programs that provide the same educational program for every surgery center in the country, you are going to have a problem during a survey. And you're also going to have employees that are not totally up to date on all those things that they have to be up to date on related to your specific center. So one of the biggest issues that I as a surveyor confront is the lack of knowledge on the part of the administration of the conditions for coverage and the interpreted guidelines. I can't believe I'm saying this after 30 years in the industry, but remember that the conditions for coverage, the interpreted guidelines are the Medicare regulations. They're the rules that you have to file. A survey is an open book test. And, just like any open book test, you need to be able to refer back to it at any point in time. You don't have to have it memorized, but you need to know what's in that book. So read through the conditions for coverage and interpreted guidelines on a regular basis, study them, know them by heart. I mean, not word for word, but know that they are the basis for the policies and procedures that you've established and of course, what occurs during a survey. And the administrator and the nurse manager have to be the best educated people when it comes to that. You also have to educate your governing body about them at least once a year. Remind them of those regulations that govern the way that they get together and meet and how they document governing body minutes. We're going to provide a link to these free resources in our show notes here. And I'll also provide a link to a full-day course that we have offered. We did it in, I think the last recording was in November of 2023. And remember, if you're a patron member, you have free access to the program. Otherwise, it's a relatively reasonable price for that. But it is a full 8 hours of a discussion about the Medicare regulations and the interpreted guidelines. Another thing that I find is, very surprisingly, is that when I come out to do an accreditation survey, the administrator, director of nursing, and the staff might not be aware of the accreditation standards. It's always shocking to me and kind of disappointing when I point out a standard and, the administrator, the director of nursing comes back to me and says, oh, where's that in writing? Or, I never knew about that. And yet we have obviously made that available to the centers, and there's an expectation that they follow it. So you need to keep up to date with the accreditation standards. Always have a copy of them available either on paper or, electronically. And make sure that everyone in your organization is educated about them also. And by the way, don't forget about state regulations too. Almost all states have state regulations that might be very close to what the federal regulations are and the accreditation standards are, but there will always be some differences that you have to be up to date on. So make sure that you are reading those also. And, make sure you build your policy and procedure programs around the regulations, the licensure rules for your state, and the accreditation standards. So let's talk a little bit about some of those critical areas and the areas that tend to be a problem during a survey. First, of course, is the governing body minutes. You need to make sure the governing body meets on a regular basis and that the governing body minutes reflect the activities of that. I, as a surveyor, don't see the governing body generally. And even if I did see them, I wouldn't know their activities. So the only way that I know that the governing body is doing what it needs to do under the regulations is by reading through the minutes. So remember that the conditions for coverage, the interpreted guidelines, the state regulations, the accreditation standards all provide guidance to you as to what should be included in the governing body minutes. And if they're appropriate, this is something I feel pretty comfortable saying. If your governing body minutes are appropriate, they're probably going to be at least 4 pages long for a regular meeting. So make sure that the governing body minutes provide documentation of their oversight, the governing body's oversight of your quality improvement plan, your infection control program, your emergency preparedness, and your peer review programs. Those are most important, but there are other things that would be included in the conditions for coverage and interpreted guidelines. I not infrequently look at governing body minutes and I'll just see, extensive discussion of finances and the distribution without a lot of discussion about everything else. But more than 3/4 of your minutes need to be focused on those things I mentioned before, the QAPI, the infection control, emergency preparedness, peer review, et cetera. And then also your quality improvement minutes are going to be very important. You're going to want to make sure that you have an extensive discussion about incidents, make sure that you're closing the loop on all of the quality improvement activities, and that you have good tracking and trending of all of the incidents and all of the activities that occur in your quality improvement meeting. I know that's a very brief overview, and we have done quite a number of episodes in the past on quality improvement, so I really refer you back to that to make sure you're up to date. I do want to kind of focus on incident reporting for a second, Sue. I know this is an area that you and I talk about quite a bit with our clients, and we talk about it often on Saturday mornings with our drop-in, the people that drop into our patron member program on Saturday mornings. But you as a surveyor, we're going to spend time looking at your incident reports. And I don't want to see somebody telling to me, oh, I don't have any incidents in the past 3 years, because you will have had incidents in the past couple of years. Now, those incidents might not be patient-related, but things are going to occur that don't normally occur, that shouldn't have occurred in your organization, and those should be included in that. And again, enough said about that right now, but I do refer you back to previous episodes to talk about that. The policy manual is one of those things that the surveyors are going to spend, some time on, at least an hour, maybe a couple hours reviewing it, going through it, double checking to make sure the policy manual addresses all the things that are included in the accreditation standards and the regulations. We want to make sure it's always up to date and that it absolutely reflects what has actually happened in your surgery center. Sue, when we take over a new center, one of the things that we often find is just some weird things in those policy manuals, like, like
it's either hospital-based or got policies on procedures that you don't even do.
Right. Maybe you're talking about sterile processing and you're a GI center that doesn't even have a sterilizer. That's a very frequent problem. And
you just got it from somebody else and nobody bothered to look through it and see what was even in it.
And you as the administrator, the director of nursing, should not be the only ones that ever look at that policy manual, obviously. You have to have your staff look at it. They need to be up to date on it. Encourage them anytime they have downtime to read through that policy manual.
And get feedback from them, people in different departments. Make sure that it's reflecting what they're doing, and they're the best ones that can tell you that.
Risk assessments are another issue that is coming up a lot more recently. And let's just remind you, and we have talked about risk assessments in previous episodes, but you want to make sure that on an annual basis you do an infection control risk assessment. That should be the basis for your annual infection control program. Make sure you do a hazard vulnerability analysis, which is a basis for your emergency preparedness plan. Make sure you do a chemical risk assessment. Now, that doesn't get done every year. Chemical risk assessment is something that you maintain. You prepare it and then update it anytime you bring new chemicals into your organization. I should point out that the chemical risk assessment is an OSHA requirement. Accreditation surveyors or your state or federal surveyors might not necessarily be looking at that particular assessment, but it is something that you have to maintain from a OSHA standpoint. There are some less important risk assessments, probably not the right term there, less common risk assessments like the wet room analysis that you would require if you don't have a line isolation monitor or a GFCI circuit in your operating rooms. An NFPA 99 risk assessment, which would have been completed prior to construction of your organization or of your surgery center. And an infection control risk assessment, which has to be prepared anytime you do construction. Another area that's often a problem during a survey is credentialing. And I know we have spent a lot of time talking about credentialing and privileging over the years on the podcast, and we have a full day and a half conference actually that I'll provide a link to if you need more information or need to provide an education program for your credentialing coordinator. But the biggest things that I find as a surveyor is often the primary source verification hasn't been done properly or hasn't been done at all, that the re-credentialing has not been done. In other words, providers' privileges have expired. So you want to make sure the re-credentialing is done on a timely basis. And remember, you have to do peer review before you provide or renew somebody's privileges. And that peer review has to be reported to the governing body and be used as a basis for granting those privileges.
Yeah. And that's a good point, is that you have to make sure that your dates are all appropriate, you know, that you can get permission to look into some of these primary source verifications before you look into them, and, you know, that the application is in first and all of that. A lot of times we see the dates kind of haphazard, as though they just kind of went through the process but didn't follow the steps.
And to your point, I just did a survey recently where there were no dates in the privileges or in the governing body. So I couldn't tell. I mean, I had to cite them, and actually they ended up having to have a revisit as a result of their governing body minutes really not reflecting the granting of privileges. Another problem, Sue, and you and I talk about this quite a bit too in our various conferences. You need to make sure that you understand the difference between credentialing and privileging. Credentialing is the process of looking at the credentials of the provider. So in other words, those things that they have gone through, the educational programs they've had, the certifications that they have, you know, their licenses, et cetera, to determine that person is eligible to be a member of your medical staff. And privileging is the process that the governing body goes through to actually grant privileges to do specific procedures. And that has to be reflected in the governing body minutes. Credentials are an administrative function. It's usually performed by the administrator, director of nursing, or administrative staff. Privileging, on the other hand, is the governing body's responsibility, and it is the point at which you've actually given a provider the ability to be able to work in your surgery center. Without that, they should not be working in your surgery center. As I said, we did a full day and a half conference in early 2024, and we'll provide a link to that if you're interested. So bringing this all together, I do recommend that on an annual basis you do a mock survey or engage somebody to come in and do a mock survey for you. You don't have to necessarily hire somebody to do a mock survey. It does help you to have an outside person view it. But at least on an annual basis, somebody should be looking at all of those things that would be included in a survey to make sure that you're ready for that survey. So understand the source of the regulations and the accreditation standards, as I said, and just reiterate again, make sure you know the conditions for coverage, interpretive guidelines, and accreditation standards, as well as the state regulations. Read and understand it. Share with your staff. Don't make this a secret. This is something everybody needs to know. And realize and make sure you emphasize to your staff and to the owners and to the providers that failure to follow the regulations, failure to follow the conditions for coverage could result in your loss of a license, state license, your loss of certification, your loss of accreditation. And once you've lost it, it's a much more difficult process to get it back again. So always be prepared for a survey. And make sure you develop your policies and procedures around the conditions for coverage, interpretive guidelines, and the accreditation standards. And lastly, I just want to remember, always be prepared for a survey. Make sure your staff understand, again, that a surveyor can appear at any time. Make that preparedness part of your quality improvement plan. Prepare a survey protocol like I talked about earlier. And as part of that survey protocol, make sure that your staff knows what to do when a surveyor shows up. And remember, you as the administrator or you as the director of nursing might not be there when they show up. You can't tell a surveyor, "Oh, please come back another day when the administration is here." So if you're planning a vacation, if you are out sick, make sure somebody has been appointed to be that front person for the survey. We've mentioned this before, but it's always advisable when a surveyor shows up unexpectedly to call in additional resources, because it's going to be difficult for you to handle an emergency or handle just general staffing there in your organization during a survey. So you probably want to have some additional resources available to you. And if you can't, you might have to consider canceling some cases. So,
and on that point about an emergency, I know you said that something like that has happened when you've been on surveys.
Yeah.
And don't ever worry about the surveyor at that point.
Right.
Which seems obvious, but sometimes people, I think, get so nervous and they don't want to just not focus on the surveyor, but you want to see that they're handling the emergency.
You're absolutely right. I think often, and this happened to me a couple times, often during an emergency that occurs during a survey, I see people at their best. In many ways, I can't think of a situation where it has not gone off well.
Yeah.
Because to your point, at that point, their automatic instincts kick in. Hopefully, they've done a good job with their drills, that are prepared for an emergency, know how to react to it. And they often forget about me, and thankfully for that.
As they should.
As they should. And I will, your surveyor is going to get out of the way. If they're not getting out of the way during an emergency, by the way, feel free to tell them, sorry, this is an emergency. Can you please, back off and provide us, the ability to do what we need to do. And a good surveyor, of course, is going to do that.
Yeah. And I think that the overall point is that anything you're doing that will help you pass a survey is probably also providing good patient care. So
that's right.
This isn't just about being ready for a survey, although that's obviously what we're focusing on, but
yeah, you bring up a very good point that we probably should end on, is that being prepared for a survey means doing the right thing all the time and recognizing that regulations and accreditation standards are there not to annoy you, but to make sure that you do provide the highest quality care.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking engagements for John and his staff and other events in the ASC industry.
We do want to remind everybody to, especially after our conversation during that second segment there, to keep an eye out for your accreditation organization educational programs. Each of them have, various ways of providing education, be it conferences, be it online education that might be available to you, et cetera, or just, visiting their website. So definitely spend some time as we begin the new year, making sure that you know what programs are available to you to help you prepare for a survey.
So on that note, HHC Achieving Accreditation is March 20th and 21st, 2025 at the Renaissance Orlando at SeaWorld in Orlando, Florida.
And the Joint Commission Ambulatory Care Conference is going to be November 5th through the 6th, 2025 at the Crown Plaza, Chicago O'Hare in Rosemont, Illinois.
And the Georgia and South Carolina ASC Associations Semi-Annual Conference and Trade Shows is March 20th and 21st, 2025 in Atlanta, Georgia at the Renaissance Atlanta Waverly.
The Florida Society of Ambulatory Surgical Centers Quality and Risk Management Conference is April 10th through the 11th, 2025 at the Renaissance Tampa International Plaza Hotel.
And ASCA's 2025 Conference and Expo is April 30th to May 3rd, 2025 at the Gaylord Rockies Resort and Convention Center in Denver, Colorado.
And as we mentioned earlier in the podcast, sign up quickly in order to be able to take advantage of those discounts. And the Gulf States Conference, which is the Alabama, Louisiana, and Mississippi Ambulatory Surgery Center Associations Conference, will be June 11th through the 13th, 2025 at the Ritz-Carlton, New Orleans.
And the Florida Society of Ambulatory Surgical Centers Annual Conference and Trade Show is July 23rd through the 25th, 2025 at Hilton, Orlando.
And the Washington Ambulatory Surgery Center Association's 2025 Annual Education Conference and Trade Show is November 6th and 7th, 2025 at the Tulalip Resort and Spa in Tulalip, Washington. Don't forget, on-demand versions of the ASC Director of Nursing, ASC Administrators, and ASC Business Office Managers Boot Camp are available on our sister website, asc-central.com. And a reminder to everyone to become a patron member of the podcast. Don't miss out on the benefits of joining our patron member program, which is available at asc-central.com. This comprehensive membership platform is your go-to resource for all aspects of ASC regulatory and accreditation, compliance, operations, and financial management. It's designed with the busy schedules, administrators, nurse managers, and business office managers in mind. By becoming a member, you gain access to regular Zoom sessions, typically held on Saturdays right now, and they're usually on a weekly basis, where you can engage with other patrons and our podcast team. But that's just the beginning. Your membership unlocks a wide range of resources, including virtual conferences, such as the Credentialing conference we referred to earlier and the Conditions for Coverage conference that we referred to earlier. You also find very valuable tools such as sample policies and procedures, forms, and our highly regarded fire and disaster drill kits. Your support helps us to maintain and grow the podcast, covering essential costs like research, travel, equipment, and production. To learn more and to become a member, of course, visit asc-central.com. Sue, I think the last time I looked, we're well over 300 podcast patron members at this point. Okay. So it is definitely a very important part of many of our listeners' lives. Mm-hmm. Thank you for tuning in to this episode of the ASC Podcast with John Goehle. We hope you found the discussion insightful. If you did, please share it with your colleagues in the ASC community and be sure to subscribe so you never miss an episode. We appreciate your feedback and suggestions for future topics. Reach out anytime at comments@ascpodcast.com.
A special thank you goes out to our incredible team, sound editor Susan Cronkite, executive producer John Goehle, and our committed research team Sue Cronkite, Jenna Alvarez, Judy D'Ambrosio, Mike D'Ambrosio, Alex Borneman, Zach Kelleritis, Jim Masters, Amy Cronkite, Lori Rodericks, Kathy Fody, Donna Macchio, and Christina Norman. Your hard work makes this podcast possible. Our theme music is by Media Sushi and Mike Noah. The ASC Podcast with John Goehle is hosted on Podbean and can be found on all major podcast platforms. Thanks for listening, and we'll see you in the next episode. This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, RFX Solutions, Trivalence, MedServ, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. RFX Solutions is your all-in-one healthcare regulatory compliance software. Trivalence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. MedServ offers the only digital narcotics cabinet specifically designed and priced for surgery centers, helping to standardize processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our webpage at ascpodcast.com.
This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. And we would love to hear your questions and comments. Please email us at comments@ascpodcast.com.